I'm Chloe Janishek. Imagine you just get done with a doctor's appointment and you're told you have diabetes. The doctor gave you all this information on your diagnosis and what you need to do for treatment, but everything he or she said to you sounds like a foreign language. The American College of Physicians says it's estimated that up to half of the adults in the U.S., 90 million people, have difficulty understanding what their doctor tells them about why they are sick and how to take the medications they are giving. This results in 20 to 30% of prescriptions for chronic medical conditions never being filled and at least half of these medications not being taken. Health literacy is a significant, under-recognized issue affecting patients today. According to the National Network of Libraries of Medicine, health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. The visual aid shows that patients with low health literacy have longer hospital stays and a higher mortality rate. Because there is a large issue with health literacy among many patients, there should be free community-based classes that teach self-advocacy and effective communication with healthcare providers. Today, I'm going to share with you why communication is vital in healthcare, why it's difficult for patients and healthcare providers to communicate, and why there should be free classes to educate the public. In order to understand health literacy errors, let's first discuss why communication is important. Communication in all places of work is important because it allows companies to be productive and operate effectively. The importance of communication in healthcare can help prevent injuries and death, increase trust between patient and the care provider, and strengthen relationships with other staff members. Good communication skills are required by all healthcare professionals, no matter their status. Improved communication between caregivers, their care recipients, and healthcare professionals has the potential to reduce error and increase productivity. Now that we are able to understand the importance of communication, we can start to learn why it's difficult for patients and healthcare providers to communicate. The public is losing trust in our healthcare systems. Part of this is because of the lack of health literacy. They often feel the professionals do not listen to their concerns and needs. According to the Journal of American Osteopathic Association, patients who understand their doctors are more likely to acknowledge health problems, understand their treatment options, modify their behavior accordingly, and follow their medical schedules. Linda Gerges on Physicians Weekly states, doctors now have to document many metrics and putting data into our EHR systems in order to meet requirements. Patients take this constant documenting as a lack of eye contact and as a sign that their professional is more interested in their digital record. Because the patient feels they're no longer being listened to, which often is not the case, this can cause a miscommunication between the patient and the care professional. Oftentimes, our health professionals do not speak in layman's terms, making it much harder for us as patients to understand what is being said. Most of us have not taken a medical terminology class and cannot understand the complicated words they're throwing our way, which often results in miscommunication. To prevent this from happening, health professionals should assess what the patient already knows, keep things simple, and slow down to make sure their patient is understanding what is being told of them. Due to the difficulty to communicate between patients and health professionals, there should be classes to prevent this from being a repetitive occurrence. Have you ever walked out of a doctor's visit and wondered what you were just diagnosed with and had to do more research on your own time? I know I've done this a handful. Because of the communication difficulty with patients and healthcare professionals, there should be free community-based classes that teach self-advocacy, health literacy, and effective communication with healthcare providers. Free community-based classes would help to prevent hospitalizations, deaths, and much more. The classes would help educate patients and assist them in receiving the information needed to be the healthiest that they can be. As you can see, there are many benefits to these classes that should be easily accessible to all people. Communication in healthcare is vital to prevent injuries and deaths and increase the trust between the patient and the care provider. Oftentimes, patients feel they are not being heard and understood by their care providers. This causes a difficulty in communication between the two. To help prevent miscommunications, increase hospitalizations, and deaths from occurring, there should be free community-based classes that teach self-advocacy, health literacy, and effective communication between patients and the care provider.